Hello, I'm Dr Tamanna Kharb, a clinical psychologist, certified hypnotherapist, and I have a little over 6 years of hands-on experience in the field and have been fortunate to work in very different settings, hospitals and private clinics. Over these years, I have met people from every walks of life, children struggling in school, young adults being anxious or relationship issues, parents balancing careers, family pressures, and older adults navigating loneliness or grief. My academic path started with a professional diploma in clinical psychology and a PhD in clinical psychology. Along the way, I'm also trained as a hypnotherapist. Working with such a wide range of people and problems has taught me one simple but powerful truth. Healing begins with understanding. Real change doesn't start with quick fixes or advice. It starts when a person feels heard without a judgment. That belief shapes everything I do in therapy, whether I'm using cognitive behavior therapy or hypnotherapy or simply listening. My first goal is always to understand because that's where the healing process truly takes place. Over the years, I have worked with a wide range of concerns, but some areas have become a natural focus of my practice. I frequently work with anxiety and depression, healing people understand the thoughts and patterns that keep them stuck and teaching practical skills to manage them. I see many clients from relationship and couple issues as well, be it communication breakdowns, trust problems, or navigating family pressures, which is very common in India culture. Trauma work is another key part of my practice, whether it's childhood trauma, emotional abuse, or the aftermath of a difficult life event. I use approaches like trauma focused CBT and hypnotherapy to help clients process memories safely. I work with children and adolescents as well, including cases of ADHD, behavioral concerns, and school related stress. My background in hypnotherapy adds an extra dimension, allowing deeper relaxation and insight when appropriate. Having trained and worked in various settings, I have met clients from very different backgrounds: students, working professionals, parents, and older adults. This variety keeps me grounded in one important truth. No matter what the label or life situation is, every person's struggle is unique. And my role is to meet them where they are and tailor therapy to their specific needs rather than focusing them into a one size fits all approach. The very first session with me is meant to feel like a safe, welcoming conversation rather than a clinical interview. Most people arrive a little nervous, so I begin by explaining how the sessions look like, how the therapy will look like, and maybe answering to the questions that they have about therapy itself. I gently ask about your personal history, your daily routines, your relationships, and any major life event that maybe have shaped your current symptoms. I also explain the practical details such as confidentiality, sessions key frequency, and how we will track the progress. Feeling nervous before starting therapy is absolutely normal. Many people worry about being judged, not knowing what to say, or fearing that their problems are not big enough. I always acknowledge this at the beginning and explain that it's okay to feel unsure. In our first session, I focused on making the environment warm and relaxed rather than formal. And I'll just remind you that you control the space. You never have to share anything that you're not ready for. Sometimes I start with simple open questions like, how was your week and what brought you here today, instead of diving straight into heavy topics. The number of sessions really depends on the person and the concerns they are facing. Some people come in with very specific problems like coping with a recent breakup or maybe managing exam stress and start feeling relief within first 4 to 6 sessions. Others are working through deeper issues like long-term anxiety, depression, or childhood trauma, which naturally takes more time. In those cases, therapy can last several months or longer, with the process happening in steady layers. When therapy doesn't seem to be working, the first thing I do is pause and look closely at what's happening and check if the approach matches the person's need, their lifestyle, or even their readiness to change. Sometimes small adjustments like changing techniques, focusing on a different issue, or adding support makes a big difference. I also encourage honest conversations about what feels helpful and what doesn't, because therapy only works if it fits you. If needed, I explore other complementary support like mindfulness, structured routines, or in some cases, medical consultation. For me, creating a safe space is the foundation of therapy. I start by really listening without judgment and make sure clients know their feeling and experiences are valid. I check in regularly about how they are feeling in sessions and adjust my approach if something doesn't feel right. Confidentiality, empathy, and patience are the key, but I also try to make the space feel comfortable and human, not very clinical. When people feel truly heard and understood, that's where the real change begins. I would say that therapy isn't about fixing you, it's about understanding yourself and finding ways to cope better. Even if you think it's not for you, just imagine having a safe space where you can speak freely without judgment and someone truly listens. Often, the first session itself can change how you see your challenges. Therapy is just a support and guidance. It's if you are willing to explore and take care of your mental health. I have seen a lot of positive changes in my clients. Some became more confident in expressing themselves, others managed stress or their emotions more effectively. Many start noticing patterns in their thoughts and behaviors and even feel more in control of their lives. Even small shifts like improved sleep, better relationships, clearer decision making can make a huge difference. Therapy helps people connect with themselves and their strengths, which often shows up in everyday life. For example, in people with anxiety issues and panic issues, after teaching a lot of relaxation exercises and grounding techniques, we have noticed that whenever they feel like they are about to become anxious, they use the exercises regularly, and the intensity of that anxiety is slowly decreased. They are becoming more happier, they are becoming more confident in themselves. One other important change that I notice is the perception, how people perceive their situations, how people perceive others' behaviors, and how they react to it. These are the small changes that make a really big difference in their lives. In cognitive behavior therapy, we usually teach people how our thoughts directly impacts our feelings, and our feelings then directly impact our behavior. So, for the people who are facing problems in negative cognition, their thought process is always negative. They are not able to find the positives in things around them. We can use CBT with them. People who usually over think about any situation, people who are very, very anxious about what is going to happen in the future, CBT works very well with such kind of people. With people struggling with anxiety and depression, with anxiety specifically, I use relaxation techniques, I use grounding techniques, and for depression, I use cognitive behavioral approach and hypnotherapy wherever required. If the concerns are coming from past traumas, coming from childhood issues, then we might use hypnotherapy as well for the deeper insights. If you want to book an online therapy session with me, you can find me on Fyp Life, an online mental health and wellness platform.